Extension agents across the state have repeatedly received questions about sort of the aging process, the death and dying process, and we've consistently found across the state that people are just generally uneducated or undereducated about what hospice is and how it works. And so we feel as though it's important to educate our state and others on what is hospice, how do we access these services, so that we are really providing the best services and support and education for individuals across the state throughout literally their entire life.
According to the Center for Disease Control's National Center for Health Statistics, 1.5 million patients received hospice care in 2020. With the number of baby boomers currently in the U.S. and an increasing understanding of the benefits of hospice care, those numbers are expected to continue to increase. There are 4 levels of hospice care: routine care, respite care, continuous care, and general inpatient care, which can be provided in various locations, such as in-home or in a facility. A new 4-page fact sheet from K-State Research and Extension Family and Consumer Sciences, Understanding Hospice, helps explain how hospice care works. This includes how hospice focuses on comfort, not curing, the healthcare providers, professionals, and volunteers that make up the hospice team, qualifying for hospice care, finding a provider, 5 common myths about hospice, talking about hospice and end-of-life wishes, and questions to ask before seeking end-of-life care. On today's Sound Living, giving people the freedom to choose how they wish to spend their remaining days. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Kansas State University Extension Specialist in Adult Development and Aging, Erin Martinez, says that hospice addresses the health and well-being of the whole person. Erin, a recent publication deals with understanding hospice, and really it's something that we hear. It's a term we hear quite often, but maybe fully don't understand. So first off, just what do we mean by hospice?
Hospice is a form of care that focuses on comfort but not curing. So it's a customized model of care that helps people with life-limiting illnesses live with dignity. So it's really helping us live out our best life when we are nearing death, but it doesn't mean that death is imminent. So it's really thinking about that entire dying process and making that as best as it can be.
And there is really a hospice team then that is involved with this process?
So a hospice team is comprised of a lot of individuals that all have a very unique and important role. So of course you're going to have a traditional healthcare provider of some sort, such as a physician. You may also have registered nurses, hospice aides, social workers, and sometimes even community volunteers that can help give caregivers a break, which is also called respite. And sometimes you might have a chaplain or other, religious aid if that's desired for you as well. So it's a whole team of folks who specialize in death and dying and making that a great experience for both the patient and their family as well.
That's an important point because a lot of this initially falls on the family until they decide whether hospice is right or not for them. And it is something that is just a lot of caregiving when you reach that point.
Yeah, so when we reach the end of our life, unfortunately, there is a lot involved in that. And sometimes death can be complicated and tough, and other times it can be smooth. But the goal of hospice is to really make this an easier process, keep people comfortable, help keep the family informed and educated, and walk everyone through this process so that it can be really a healing and a good end of your life.
In terms of who is eligible for hospice or how you find out if someone would be eligible, what is the process for that?
So you become eligible for hospice when you've been diagnosed by a physician with a terminal illness, having a prognosis of 6 months or less to live if the disease were to run its normal course. So kind of a complicated way to become eligible for it, but ultimately we're looking at individuals who have about 6 months of life left, according to their physician. So if you decide to enter into hospice care, you really must agree that you are dedicated to going towards this comfort route versus the curing route. Because when you're in hospice, the goal is not to cure or treat whatever disease or illness that you have. Rather, it's to keep you comfortable and help ease the dying process. But you don't always die when you're on hospice, so you can go in and out of hospice. That's pretty common as well. But there's certain qualifications that you must meet. And of course, you must visit with your insurance provider, Medicare, Medicaid, the VA's office, wherever you're getting those benefits from to learn more about what will help you qualify and what will be covered.
And you also, I guess, have to find a provider, and I don't know the complications involved with that.
So it's recommended really just to talk with your primary care provider first. Oftentimes those people who are working in the medical field and know the individuals or the organizations that provide hospice care in your local community. But you can also contact Medicare through their general line, which is 1-800-MEDICARE, and ask them, what are the hospice providers that are approved in my community or as close to me as possible. But another key idea is to talk to people who have been through this before. Who has had a great experience with a particular hospice provider? Who are the known people in the community for providing this great service? So word of mouth can sometimes be a fantastic way to learn about these resources.
Well, and just in general, that might be a great way to find out the entire process. Learn from someone who's been through it and the things that maybe your family needs to consider.
Absolutely. I mean, people who have been through it know how the process works. They've had that experience and they have that emotional connection to it as well. So it's not just the process, but it's also the feelings and overall experience with that. So talking with people who have been through this process before and who have experienced hospice as a family, because hospice is not only for the patient, it's for the entire family and community as well. But talking with others can be really beneficial.
And some of this also boils down to whether you would like to go to a facility or whether they would be coming to the home.
Yeah, so hospice can be provided in multiple locations and in multiple ways. So sometimes hospice will come into your home if that's what you choose. You can also choose to go to a hospice facility that's very much like a home-like environment. So really, it just depends on your needs and desires, but there are options available to you.
I know we talked about talking this out as a family, but really, I guess the final choice is really the person who's receiving the hospice care?
Yes. So ultimately, the decision should be left to that individual who is receiving hospice care. This should be a family-based decision. Communication is key. But ultimately, at the end of the day, it's that person's life, and it should be their choice of what they want to experience at the end of their life.
When we're talking about healthcare issues, it seems like there are always some things that are factual, and there are some things that people believe. Some of them are true, some of them are just myths, but they kind of get ingrained in the mind, and there are about 5 or 6 myths that go along with this as well.
Yeah, so one of the biggest myths that we hear is that hospice is only for the last weeks or days of your life. But in fact, as we mentioned earlier, you're looking at about 6 months is generally what helps you qualify for hospice care. So you can be on hospice care for months at a time. There's also the misconception that hospice means you've given up and that you're just throwing your hands up and you're ready to die, which some people may experience that and they may have come to terms with their death and they really are ready to go forward with the end of their life. However, that doesn't mean that you've given up. This really means that you want to live out your final days in the best way possible, being comfortable, being able to spend meaningful time with your family. There's also the myth that hospice care will essentially speed up your death, that hospice is going to give you medications that are just going to, help you die quickly. And that's not the case. That's not how that works. And hospice, again, really focuses on that comfort care, not speeding up the death process. And there's also a myth that sedation is common and widely used, meaning that essentially we're giving people medication to help them sleep through their final days. But that's not the case. Again, we're giving low dosages of medication that's going to help people stay comfortable and alleviate as many symptoms as possible. And also the last myth is that hospice care is just for the dying patient. But we know that hospice provides caregiving assistance, grief counseling, and bereavement services even after a person's death. So it's really care for the entire family and for that person's entire community of friends and family.
That's really important, the fact that there is the comfort involved. And with that, I think this has got to reduce the stress and anxiety and make the whole process much easier for the entire family.
Yeah, we don't always experience death every single day in our lives. And so if this is the first time that you're experiencing a family member's death or a family member on hospice, simply you may not know what's happening, what to do, how to do it, what to do to make a person more comfortable, even how to navigate your own grief process. So having this person there, this team there, can really help guide the family through the death process and make it an overall just better experience. So that expertise and that support is key.
Maybe not a myth, but something that I think does kind of come into people's minds is the fact that they think that this is always for elderly patients, but it's not.
Absolutely not. So if we're thinking about folks who have terminal cancer or other terminal illnesses, they would also qualify for hospice care as long as they meet those specific requirements. Their age is not a requirement for hospice care. And so even kiddos, unfortunately, when they're experiencing life-limiting illnesses, will go on hospice and experience the best possible end of their life through that comfort care.
I might back up and just ask how this publication came about. It's something, I guess, that we're trying to really maybe demystify some of this?
So extension agents across the state have repeatedly received questions about sort of the aging process, the death and dying process. And we've consistently found across the state that people are just generally uneducated or undereducated about what hospice is and how it works. And as we see the dramatic growth of our aging population, it's so important for us to acknowledge and recognize that death is going to happen. It's going to happen to a lot of people when we think about that baby boom generation really aging and nearing end of life. And so we feel as though it's important to educate our state and others on what is hospice, how do we access these services, so that we are really providing the best services and support and education for individuals across the state throughout literally their entire life.
Well, and you and the rest of the team that put the publication together relied on research-based information, so everything that's in there has been checked and double-checked.
Absolutely. So we always are looking at the research and the evidence behind the work that we are doing, but we also worked with several hospice care providers on this lesson and worked with folks across other institutions in the state who work in this area and do research in this space. So we're really looking to the experts on this. So it was a learning experience for all of us, but what a wonderful experience and great way for all of us to learn more about what hospice is and keep that in mind for when the time comes for us or someone in our family.
The publication will be there for people to look at and review, but I assume that there's also going to be an opportunity to go out and just speak one-on-one with the community?
Absolutely. So our extension agents have become well aware of this lesson and the key concepts behind hospice. And so they can serve as a resource in their communities to learn more about what hospice is, but also help connect individuals and families with hospice providers in their local communities, because extension agents really do serve as strong connectors throughout communities.
Well, a great opportunity to learn more about this and really fully understand what it means for the person going through hospice and the family members too.
Yes, this is a great resource to learn more about hospice and to develop those connections in our communities and really help to improve the end of life for all Kansans.
With information on a new K-State Extension Family and Consumer Sciences fact sheet, Understanding Hospice, that's Adult Development and Aging Specialist Erin Martinez. The 4-page fact sheet is available through county and district extension offices and the online bookstore, www.bookstore.ksre.ksu.edu. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.